Welcome to the CRC follow-up colonoscopy patient navigation training. This is video 2, colonoscopy and bowel prep. My name is Jamie Thompson. I'm a senior research associate at the Kaiser Permanente Center for Health Research based in Portland, Oregon. In this video, we'll talk about the colonoscopy procedure, process, and bowel prep. We will answer the following questions. What is a colonoscopy? What is the process for obtaining a colonoscopy? Why do you need to prepare for a colonoscopy? What is the colonoscopy bowel prep process? Finally, what are colonoscopy results and standard rescreening intervals? Let's begin by talking about the colonoscopy procedure. A colonoscopy is an exam that checks for problems in the colon. For the exam, the physician puts a flexible tube, an endoscope, in the rectum to view the entire colon. There is no pain because medicine is given to help the patient relax or sleep. The procedure finds common growths, also known as polyps, which can be removed to prevent colon cancer. Most polyps can be removed with a scope during the procedure. Removal of large polyps may require extended time and expertise. Here is a 5-minute animated video about what happens during and after a colonoscopy. Let's take a look at the overall colonoscopy process. First, patients with an abnormal FIT result are referred to a physician who performs colonoscopies. Most patients are successfully referred to the physician, but it's possible that you may need to follow up to help with paperwork or scheduling. Second, it's important to understand the policies of the GI practice of interest. All GI practices have their own policies related to how they prioritize patients based on insurance coverage, how they prioritize patients based on FIT positive results, whether or not patients are required to attend a pre-procedure visit before the colonoscopy, the preferred bowel prep prescribed for the colonoscopy, and the specific transportation and escort or companion rules for the colonoscopy appointment. The navigator can help the patient understand these policies. Third, the preparation for the colonoscopy is a critical step in the colonoscopy completion process. In this video, we'll discuss commonly used preps, the split prep schedule, why an extended prep may be needed, tips for patients to complete a successful prep, and common patient questions about the prep process. The final step is the colonoscopy procedure. We've already learned from the video what to expect during and after the colonoscopy. Colonoscopies are usually scheduled for 40 minutes, but plan on 2 to 3 hours from check-in to discharge to account for preparation, waiting, and recovery time. It's important to arrange for transportation to and from the appointment, as well as having a companion. Also, patients should plan to relax and have downtime after the colonoscopy to recover. So it's important to set aside a 24-hour period of downtime. The preparation for the colonoscopy is an important and challenging piece of the process. Let's talk about bowel prep. First, why does a patient need to prep for a colonoscopy? For the colonoscopy to go well, the colon must be clean. The colon needs to be clean or empty so that the physician can view it clearly. If a patient does not do a good job of emptying the colon, the physician will not be able to see it clearly. This can result in a missed polyp, a longer procedure, or even the need to repeat the colonoscopy. Let's talk about the prep process. Specific bowel prep instructions can be different for each patient because of medications they're taking. It's important to follow the instructions from the physician. In general, though, this is what patients can expect. Start with a low-fiber diet for 4 to 5 days before the procedure. Then begin a clear liquid diet on the day before the procedure. Clear liquids are allowed up to 2 hours before the colonoscopy. It's possible an extended prep may be required, so a patient would need to start the clear liquid diet 2 days before the procedure. We'll discuss this more on an upcoming slide. Finally, the bowel prep or laxative solution is typically started the day before the procedure. There are various regimens available, and most physicians recommend a split prep, which means you drink half the prep the night before the procedure and the other half of the prep on the day of the procedure. A non-split prep is not recommended anymore and is not considered standard of care. Again, a successful colonoscopy depends on a successful prep. We will talk more about each of these 3 steps on the upcoming slides. First, the low-fiber diet. In general, about 4 to 5 days before the colonoscopy, the patient needs to transition to a low-fiber diet. Sometimes this can feel challenging for patients. It's most important to advise the patient to stop eating nuts and seeds, popcorn, and corn. The reason for this is that these foods take a long time to digest, and there shouldn't be any pieces of food in the colon during the colonoscopy. Foods that are okay to eat during this time include bread, rice, pasta, eggs, milk, canned vegetables without seeds, peeled potatoes, and cooked meats like chicken or tender beef. In summary, most importantly, no nuts and seeds, no corn, no popcorn. Next, let's talk about the clear liquid diet. On the day before the colonoscopy procedure, the patient will begin a clear liquid diet. This means that the patient should consume only clear liquids like clear broth, water, clear Gatorade, black coffee without milk or cream, light colored jello. Liquids that should be avoided are red drinks, purple drinks, orange drinks, milk, and alcohol. Foods and liquids that are red or purple, even orange, can stain the colon and appear to be small amounts of blood. To help ensure an accurate colonoscopy exam, these liquids need to be avoided. Finally, let's talk about the bowel prep laxative solution. The most commonly used colonoscopy bowel preps are Miralax and Go Lightly. There are more expensive commercial low volume preps available. In this training, we'll focus on Miralax and Go Lightly. So let's start with Miralax. This is an over-the-counter bowel prep laxative solution. Here are the supplies that you need. One 238-gram bottle of Miralax, four 5 milligram tablets of bisacodyl. Dulcolax is a common brand. These tablets are often sold in a box of 10 tablets. And 64 ounces or two 32-ounce bottles of a clear liquid like Gatorade, no red, purple, or orange drinks. Now let's look at Go Lightly. Go Lightly is a prescription-only laxative solution. It's available in a 4-liter jug or a 1-gallon powder packet for reconstitution to 1 gallon when you add water. The instructions for both Miralax and Go Lightly are similar in the 4 to 5 days before the colonoscopy. During this time, the patient needs to review their bowel prep instructions from the physician. If instructed to do so, this is the time to stop taking any antiplatelet medications or certain anticoagulant medications. These are blood thinners. Also, the patient will need to stop taking iron supplements. And finally, begin the low fiber diet process and stop eating nuts, seeds, corn, and popcorn. The day before the colonoscopy is typically when patients will start the clear liquid diet and bowel prep laxative solution. For Miralax, on the day before the colonoscopy, the patient will start the clear liquid diet. Next, the patient will mix the 1 bottle of Miralax with 64 ounces of Gatorade and refrigerate the mixture. At 4 p.m. on the same day, the patient will take 2 bisacodyl tablets with a glass of water. Then start drinking 8 ounces of the Miralax mixture every 15 minutes until finishing half of the solution, and then refrigerate the remaining half. For Go Lightly, it's a very similar process. On the day before the colonoscopy, the patient will start the clear liquid diet. Next, if the patient has the 1-gallon powder packet, mix it with water until the liquid reaches the fill line on the jug and refrigerate. At 4 p.m. on the same day, start drinking 8 ounces of the jug contents every 15 minutes until finishing half of the solution. Refrigerate the remaining half. As mentioned earlier, most GIs now recommend the schedule of a split prep, where you take the prep solution in 2 doses over 2 days. A non-split prep is not recommended anymore and is not considered standard of care. On the day of the colonoscopy, for Miralax, 5 hours before the procedure, the patient should take 2 more bisacodyl tablets. Drink 8 ounces of the Miralax mixture every 15 minutes, and then continue drinking the prep and clear liquids until 2 hours before the procedure. And also take medications as directed by the physician during this period. For Go Lightly, again, it's a similar process. 5 hours before the procedure, drink the second half of the prep. Continue drinking the prep and clear liquids until 2 hours before the procedure. Take medications as directed by the physician during this period. Remember, no food or drinks within 2 hours of the colonoscopy. So how do you know that the prep worked? Here is a helpful chart. If the stool is dark with thick particles, then the patient is not ready for the colonoscopy. If the stool is brown with thick particles, the patient is still not ready for the colonoscopy. If the stool is a dark orange and semi-clear, the patient is still not ready for the colonoscopy. If the stool is light orange and mostly clear, the patient is almost ready for the colonoscopy. Finally, if the stool is light yellow and clear, the patient is ready. In some situations, the physician may call for an extended prep, which means that the bowel prep begins 2 days prior to the colonoscopy rather than 1 day before the procedure. Situations that might call for an extended prep include chronic constipation, chronic opiate therapy, and inadequate prep during a previous colonoscopy. So advise your patient according to the instructions provided by their physician. The bowel prep process is challenging for many patients. Here are some tips for more comfortable bowel preparation. The patient should arrange their schedule to be at home so they can have access to the bathroom. When drinking the prep, it really helps to add flavoring if the prep isn't already flavored. And drink it cold, use an extra wide straw, and suck on hard candy afterwards. Also, it helps to prepare the bathroom. Wear loose clothing, stock up on soft toilet paper, and use skin soothing products such as baby rash ointment. Here are some frequently asked questions from patients. I am not having bowel movements. What should I do? Bowel movements can take up to 5 to 6 hours after beginning the prep to start. Be patient. Continue to drink liquids. If you have not had a bowel movement by midnight the night prior to your procedure, you will need to reach the on call physician for further instructions. The prep is making me nauseous. What should I do? If you develop nausea or vomiting, slow down the rate at which you drink the solution. Please attempt to drink all of the laxative solution, even if it takes you longer. If vomiting persists or you're not able to finish the prep, stop the prep and call your physician's office for further instructions. Why do I have to wake up so early for the second dose? Can't I take it all the night before? A split prep has proven to be the most effective strategy for a successful colonoscopy. It is essential that you follow the directions provided with your prep medications. Now let's talk about colonoscopy results. Your role will be to make sure that the patient receives their results and understands what it means. You do not need to interpret the report. The results report will typically include information about the adequacy of prep, and inadequate prep may require the patient to get a repeat colonoscopy. Pathology report will indicate if there are polyps, adenomas, which I will define on the next slide, cancer, also known as adenocarcinoma, or any colon diseases. These findings also determine future screening intervals. We will talk about the pathology findings and future screening intervals on the next slides. As a reminder, during the colonoscopy, the physician looks for polyps and removes them. If polyps are found, they are removed and sent to a lab for testing. The size, type, and number of polyps determine the risk of colorectal cancer. Most polyps are benign or non-cancerous and cause no symptoms. However, some polyps or low-risk adenomas have a low chance of turning into cancer, and other polyps, advanced adenomas, have a higher chance of turning into cancer. Low-risk adenomas include 2 or less tubular adenomas less than 10 millimeters in size, 2 or less sessile serrated polyps less than 10 millimeters in size. Advanced adenomas include tubular adenomas greater than 10 millimeters in size, sessile serrated polyps greater than 10 millimeters in size, villous adenomas of any size, tubulovillous adenomas of any size, any adenoma with high-grade dysplasia of any size, and finally, 3 or more adenomas of any size. As mentioned earlier, the size, type, and number of polyps determine the risk for colorectal cancer. For low-risk adenomas, there is a 7% chance of progressing to an advanced stage and a 0.5% risk of colorectal cancer. Finally, here is a diagram that shows the spectrum of benign polyps to malignant adenomas. Cancer, or adenocarcinoma, can also be found during the colonoscopy. Based on the results of the colonoscopy, the physician will advise the patient about future rescreening intervals. If no polyps are found and there is no family history of colon cancer, the rescreening interval is 10 years. If 1 or 2 low-risk polyps are found, the rescreening interval is 5 to 10 years. If 3 or more high-risk polyps are found, the rescreening interval is 3 years. Finally, if a high-risk polyp must be removed in pieces, or the prep was inadequate, or the exam was incomplete, the patient will be asked to return in less than 3 years. Special considerations for earlier intervals include inadequate bowel prep, removal of a large polyp in smaller pieces, a piecemeal resection, and certain genetic conditions, and finally, inflammatory bowel disease or IBD follow-up. To review, what is a colonoscopy? A colonoscopy is an exam that checks for problems in the colon. The procedure finds common growths, also known as polyps, which can be removed to prevent colon cancer. For the exam, the physician puts a flexible tube in the rectum to view the colon. There is no pain because medicine is given to help you relax or sleep. 2. What is the process for obtaining a colonoscopy? The process for obtaining a follow-up colonoscopy begins with an abnormal FIT result, which triggers referral to a physician who performs colonoscopies. The next step is to schedule the colonoscopy and prepare for the procedure. Finally, attend and complete the colonoscopy. 3. Why do you need to prepare for a colonoscopy? For the colonoscopy to go well, the patient needs to take steps to make sure that the colon is clean. The colon needs to be clean or empty so the physician can see it clearly. If a patient does not do a good job of emptying out the colon, the physician will not be able to see it clearly. This can result in a missed polyp, a longer procedure, or even the need to repeat the colonoscopy. 4. What is the bowel prep process? Specific bowel prep instructions can be different for each patient because of medications that are being taken. However, in general, this is what patients can expect: a low fiber diet starting 4 to 5 days before the procedure, a clear liquid diet starting the day before the procedure, and bowel prep or laxative solution starting the day before the procedure. 5. What are colonoscopy results and standard rescreening intervals? Colonoscopy results include information about adequacy of prep. A repeat colonoscopy is needed if prep is inadequate. Pathology findings: the size, type, and number of polyps determine the risk of colorectal cancer. And finally, rescreening intervals. Based on the results, the rescreening interval can vary from 1 to 10 years. Finally, we'll wrap up with a short quiz. True or false? An inadequate bowel prep may result in a repeat colonoscopy. True. Inadequate bowel preparation for colonoscopy may result in a missed polyp, a longer procedure, even a repeat colonoscopy. True or false? Bowel prep may be taken in 2 doses over 2 days. True. Most GIs now recommend a split prep, taking the prep solution in 2 doses over 2 days. Follow the instructions from your physician. True or false? It is okay to drink or consume anything red or purple during the clear liquid diet. False. Foods and liquids that are red or purple, even orange, can stain the colon and appear to be small amounts of blood. To help ensure an accurate exam, these liquids need to be avoided. This concludes video 2, colonoscopy and bowel prep. Thank you for watching. For more training videos, please visit this website.